Hi, everyone. Welcome. My name is Navneet Sandhu, and I'm a program manager with Health Begins. Welcome to session 8 of our collaborative planning and implementation for our San Joaquin and Stanislaus Collaborative. Hope you all are having a good Monday so far. Just a quick reminder, as usual, these meetings are being recorded. Next slide. Okay, so we'll go ahead and get started. A few housekeeping reminders. If you haven't already, please go ahead and update your Zoom name and include the name of your organization. This is really helpful as we continue to get to know each other and for folks that may be joining us for the first time. For our chat icebreaker today, I think since we are approaching fall, we thought it would be fun just to ask everyone what they are looking forward to as we approach the fall season. You know, for me personally, I'm excited for the weather cooling down. I live in Sacramento, so it gets pretty hot over the summer, and enjoying good food. So, see any of these agreeing? Cooler weather. John is looking forward to Halloween. Lots of Halloween. Awesome. And then, so we are looking forward to a dynamic session with, we have lots of fun presentations and topics for today. So please feel free to use the chat and the hand raise function if you have questions. If you would like, please feel free to share your video. It's always nice to see people on these virtual meetings. So next slide. Okay, so welcome to anyone that's new. Thank you for joining us. For those that are new, these CPI sessions are a space for us as Medi-Cal transformation stakeholders to come together to collaborate, identify challenges, and problem solve with the ultimate goal of improving CalAIM implementation and driving utilization. So welcome to anyone that's joining. Please feel free to add questions. And if you have questions and would like to engage one-on-one, please feel free to email me. Happy to connect. And my email is just my first name at healthbegins.org. Next slide. So for today's session, we hope by the end of the session, participants will have the opportunity to learn more about local efforts to improve provider referral coordination. We'll also review opportunities to improve local data exchange efforts. We'll be hearing from Stanislaus County CSA on the HMIS system. We'll also receive updates from our MCPs, peers, as well as share some landscape updates. And then we will initiate conversations to expand the implementation of the Justice Involved initiative and expanding the provider network. Next slide. So this is the agenda that we have proposed today, but we will also propose another option just because we do have quite a bit of content and presentations planned. So I want to give you all the option to choose what works best for you all. But starting out, we're in the welcome and level setting, and then we will move to updates and resource sharing. So we'll share some general updates, hear from our MCPs. Also want to touch base on our community resource fair, which we hosted earlier this month, share some highlights, as well as have the opportunity to hear from you all on how we can improve for our next resource fair. We will have a provider spotlight from community medical centers around expanding the JI population of focused provider network. We will also touch on our provider registry to give you all another opportunity to share feedback, as well as we'll talk about some of the uses and how this could be a helpful resource. We'll have the HMIS presentation, and then excited to announce with closing that our registration is open for our September in-person session, and then we'll close out with office hours and go from there. So next slide. So as I was mentioning, we have two proposals for today. The first is I kind of provided a high-level overview of the topics / presentations that we have planned for today. We know that it can be a lot of information, and maybe you are more interested in some topics versus others. So wanted to give everyone the chance to be able to vote on whether they would like to have the opportunity to join a breakout room for the specific topics, which are the community resource fair and highlights, provider spotlight, which is around expanding the JI population of focus, and the HMIS presentation. So gonna leave that open for you all if you would prefer to stay in the main room or have the opportunity to break out, which will give more opportunities to have discussion. I am preliminarily seeing the results, and it seems like we have an overwhelming majority vote of staying in the main session. So we'll go ahead and end that poll and continue as planned. So we can go to the next slide. Alrighty, so we'll move to updates and resource sharing. So wanted to share a quick reminder again about PATH Cited, and that Cited round 4 is coming soon, which we know is the last and final round. Cited Clinic Awards were recently announced, and for any Cited Clinic eligible applications that were not awarded under Cited Clinics will also be considered for general Cited funds. We're hearing that round 3 awards will be announced in fall. I know some folks were asking for more details on a specific date, but we don't have that information yet, and we will share it out once we have that detail. And then just stay tuned for Cited Round 4. We hope to continue to have opportunities to discuss the application and provide support as needed. If you have specific questions, highly recommend reaching out to the email address that we have on the slide, cited at ca-path.com for any specific questions. Next slide. I know we've been talking about TA Marketplace a lot for folks that have been with us for a while, but just another quick reminder that TA Marketplace applications are rolling and will be accepted through 2026. The TA Marketplace is a virtual marketplace where organizations can access technical assistant resources. So there's various offerings that include custom, hands-on support, as well as off-the-shelf projects. So encourage you all to visit that link that I think we'll put in the chat. And we'll continue to have conversations on how we can best support you all in applying and utilizing this resource. Next slide. And then wanted to share some resources regarding Justice Involved. We'll also try to put these in the chat. Thank you to Ileana, who also uplifted these as helpful to share with our participants. So the first link is some frequently asked questions provided by DHCS on various different topic areas like eligibility, enrollment, and billing. So if you have questions, they may be answered on this webpage, so encourage you all to check that out. We've also included the county go live date link, which has updates on county readiness status. The third link is the MCP-JI presentation, which our MCPs have graciously shared as a resource for you all to check out, which outlines the JI initiative, the goals, kind of overview of what to expect, and also eligibility for becoming a provider and much more. And we will dive a little bit deeper into these slides in our office hours on Friday. And then something else really exciting to share is the DHCS Justice Involved Learning Collaborative meetings. They launched their first meeting last Thursday, and these meetings are a space for justice involved stakeholders like the correctional facilities, county jails, MCPs, and providers in this space to be able to convene with DHCS to share feedback regarding implementation challenges and other considerations. So highly recommend checking those out. We've included a snapshot of the upcoming session and office hours, but there is a full list in our Q&A resource document that you can look through, which outlines what to expect for each session. You do have to register for the sessions, but the office hours are open, so you just need to click on the Zoom link. And yeah, that is a helpful resource that we wanted to uplift. And then next slide. Also wanted to share a new PATH resource, which is the PATH Funding and Engagement Benefits Guide. This is intended to help organizations explore additional PATH opportunities beyond those that they applied for or may be currently engaged in. So maybe you're newer and want to explore what are the different initiatives under PATH. This is a guide that's really helpful for providing a high-level overview of those resources, and they also have contact information at the end of the guide if you have additional questions. And this is open to all organizations, regardless of your implementation status, or I should say contracting status. And yeah, next slide. Okay. And then something else to share is DHCS request for feedback. I'm sure a lot of you all have been hearing about the closed loop referrals implementation guidance. So over the past year, DHCS has been developing this guidance for closed loop referral requirements based on feedback from you all. And this will be applied to the first priority service areas, including enhanced care management and community supports. So gonna share the link to that for you all. And if you would like to provide feedback, the deadline is September 4th, so next week on Wednesday. And we've also included the email address that you can share your feedback with. So encourage you all when you have time to look through it. It is a pretty lengthy document. So yeah, next slide. Okay, so now we will move on to our next section, which is MCP updates. So I believe we're gonna first pass it to Kaiser. You can go to the next slide. And I believe there is a representative on the line for Kaiser Permanente. I think Kelly wasn't able to attend today. So is there anyone on the line? I'm hearing silence, so I will do my best to voice over these updates, and then we'll circle back if there's anything that we missed. Next slide. So taking this as an opportunity, Kaiser wanted to share their results on their ECM and community supports provider capacity gap survey results. So they asked 5 different questions on what gaps there are in capacity that they've observed and that you've observed in your county, and how could MCPs be helpful in closing those gaps. So they received 160 responses from 9 different types of organizations, which included ECM providers, community supports providers, CBOs, and etc. And then also submitted a county-specific narrative for needs assessment to DHCS. Next slide.
Hi, this is Jillian from KP. So sorry, I was having some audio issues earlier. Thanks so much for having me. I'm stepping in for Kelly today.
Okay,
And thanks for covering that slide. Sorry about that.
yeah, I will pass it to you. Thank you. Appreciate it.
Yeah. So when we went and we looked at the gaps in ECM, we were able to find a lot of commonalities. So some of those themes you see in front of you today, we specifically looked at youth and children, referrals, data exchange, standardization of policies, justice-involved population of focus. And as a lot of you are aware on this call, this is also not specific to Kaiser, but is something that we want to identify as an organization and then move to make progress in. Okay, next slide. So we're going to work on the gaps in education and awareness, including some marketing communication materials for providers. In here, you can see some of those details of kind of our plans to move forward. Also gaps in process. So this would include referral volume and process, kind of the portal and referral systems, making those more clear. And again, that does have some overlap with the education piece. Communication between ECM and CS providers. So just making sure that the partnership between all of those, if they're separate organizations, we make sure that pathway of communication is really clear. And then also we have discussions around the gaps in capacity building, specifically for children and youth providers. And we're looking into startup funding to build capacity as well. So regarding the CS gaps, we were able to identify a couple as well. Again, kind of similar to the ECM, a lot of these themes are seen for other folks as well. So we're specifically looking to target heightened referrals and the strength in our referral system. This will go along with referral training. We're especially looking to target our asthma remediation utilization, which is specifically low in regards to our community supports. And housing resources. So we have quite a few housing resources available. So just making sure that those specifications are known in our community and with our providers and what's available. So the gaps in awareness and education training, there's a lack of understanding about community supports in general among frontline workers. Our workers go into the field looking to try to help folks. And if they don't know, then they're not able to access it and, push it forward. We'll look to help solve this through additional marketing and training to increase referrals, worker education, best practices across providers and MCPs, and then gaps in the process. And we're looking for more referrals. Many case managers and other personnel are uninformed and uncertain on who to refer to or how to make referrals. And then we're looking to share specific providers when training about community supports. So then they have specific folks that they're able to talk to and a good point of contact to reach out to with their questions. This is also an event that's coming up that we're helping sponsor. So it's the California Recuperative Care Symposium. So if you are interested in this, we wanted to just share this information. It's coming up next month, right around the corner. Let us know if you have any questions. How a community-based organization can serve KP members. KP is working with the 3 network lead entities to develop a network of community-based ECM, CS, and community health worker providers. If you have an organization that wishes to become part of an NLE network, you can send an email message to these ones below. They're listed on the slide. I can also drop them in the chat after this call as well to make sure that you're able to get them. But because of how our contracting is going here at Kaiser, we are doing our contracts through the network lead entities, which is a little different than some of the other folks on this call. So if you do have questions, I'll also drop my email in the chat and feel free to reach out to me as well. And then here are just some general resources as well, including our toolkit and numbers for our general lines. But like I said, also feel free to reach out to me for any questions as well. We want to make sure that we're getting you linked to the right places. Thank you.
Great. And then before we move on, were there any questions for Kaiser? Just wanted to save space. If not, then we'll pass it to Niyati from Health Plan of San Joaquin for updates.
Good afternoon, everybody. Can everyone hear me all right? Okay. Hi, I'm Niyati Reddy. For those that don't know me, Director of Special Projects Operations at the Health Plan, focusing on San Joaquin and Stanislaus. Thank you all again for joining I don't want to repeat anything Kaiser was saying, but just overall, I'd love to just give some quick highlights here. For those providers, I see many of our providers, so thank you for joining. Just a friendly reminder that we have an updated HCPC coding guidance from DHCS. So some of the codes have been updated, so take a good look at that. DHCS did a great job about highlighting some of the updates. So I believe June 2024, there were some recent updates. So make sure you look through that, make sure you have your systems updated. And again, that is for billing purposes. CalAIM program year 3, that has concluded now. It was the final year as part of the incentive payment program. So thank you for all of the providers that participated in all of the 3 years. We funded quite a few providers in both San Joaquin and Stanislaus over the 3 years, and a lot of great work has come out from that. So that's great news. And I just wanted to do a call out to Sierra Vista Child and Family Services in Modesto. They had a spotlight that was highlighted on DHCS's news release. So take a look at that. They did some great work, behavioral health services work in terms of expanding to 4,800 community members annually. So take a look at that if you have some spare time, and congratulations to Sierra Vista Child and Family. I know today's collaborative is going to be quite focused on justice involved, so I won't talk much about that, but I wanted to remind folks about outreach and engagement. Our theme this year of 2024, especially with the health plan, is really boosting and increasing utilization in both ECM, community support, and the CHW work. I want to make note that, in order to make ECM successful, it's really important for the ECM providers to partner with local FQHCs, local partners in the community, because that would be also an opportunity to connect members as well, right? Just because you receive a pursuit list, sometimes our pursuit list is based on eligibility requirements. It might be light, maybe, just a drizzle or dabble of members, but it's really important for ECM providers to make that connection in the community. I'm suggesting go to pediatric work groups, meet pediatricians, do whatever you can to be able to boost this utilization. I also wanted to remind folks that are contracted with Health Plan of San Joaquin that outreach to members can be done by both clinical and non-clinical staff. Okay, so that can be reimbursed. I want to make that clear that clinical folks can do the outreach and non-clinical staff can do the outreach. And outreach can be defined in person or telephonic, electronic. It could be successful, unsuccessful. So I want to make sure that you bill appropriately, because again, we've seen a lot of outreach billing very low. So I want to make sure that it can be done by clinical, non-clinical staff, in person, telephonic, email, texting, and that can all be submitted for reimbursement. I know that CSA is going to provide a wonderful presentation on HMIS, and this year and this year only so far, we are going to Health Plan San Joaquin with HealthNet. We are going to be paying for 5 user licenses per contracted ECM and community support provider for this year. So please take this opportunity to become an HMIS user, because all of that data and information is very needed in the community. I also wanted to end really quick that Health Plan San Joaquin has a community reinvestment grant opportunity. I am not piloting that effort, but I'm going to be dropping in where you can get the various information about our grant opportunities. For those that are interested in community health worker, we have a training grant, we have a recruitment grant. If you're interested in doula work, we also have a doula workforce recruitment grant, a lead screening grant. And then for those that just want to reach out in terms of any funding that's needed for capital purposes or even general grant, feel free to submit your application. And again, it goes through a review process. So there is a committee here at Health Plan to review that. Any questions for Health Plan San Joaquin? Okay, thank you.
Go to the next slide and I will pass it to Ileana at Health.
Thank you so much. Good afternoon, everyone. My name is Eliana Argueta, and I'm one of the regional program managers here at HealthNet, primarily overseeing the implementation of CalAIM in this particular region, San Joaquin and Stanislaus. Thank you to the plan partners. I think they touched on those initiatives and priorities that I think align between the three plans, which includes outreaching to members, increasing enrollment and utilization of services. So thank you so much for touching on that. Lastly, I just want to share in the chat the link to our HealthNet resource for providers page. This is a curated page for our CalAIM providers or those who are interested in becoming a provider. We have an array of different trainings and opportunities for learning more about CalAIM, including workflows for our community support services, enhanced care management, doula, CHW. For our current contracted providers, I also want to highlight that we have included all of our CalAIM incentives. So these incentive opportunities are additional ways where our providers can earn additional dollars for the work that you're already doing. So again, there's an array of different training opportunities and resources. Thank you to Health Begins for raising and highlighting the work that we're doing with the justice involved population of focus. That has been one of our, I want to say between all three MCPs, one of our high priorities this year. And we're expecting to see some of our providers go live with this work, which is a big lift. And again, thank you to all of our providers for being here and continuing to support us in these efforts. And thank you again, Health Begins, for raising and highlighting the justice involved work and all the training opportunities and resources available. My contact information is also in the chat in case anyone has any questions or would like to learn more information about becoming a contracted provider with HealthNet. And I'll open it to the team in case there's any questions based on that information I shared. Thank you so much.
Thank you. So we'll go ahead and move to the next slide. Okay, so wanted to take a moment to celebrate and just say a big thank you to everyone that participated in our community resource fair earlier this month. It feels like a lifetime ago, but it was earlier this month. Wanted to share some highlights from our community resource fair, and we'll also open it up for reflections and feedback from the group as well. We had 20 ECM and community supports providers table at the event. We also had all three of our MCPs come out and table as well. Amongst the staff that were tabling, we had over 50 staff show up who participated and networked with others. We had 30 eligible community members come to the resource fair, as well as we also had 13 unique organizations that weren't tabling but wanted to come out to support the event and get resources for their beneficiaries and community members. And we had 26 representatives from those organizations. In total, we had 106 attendees, which include all organizational representatives, community members that attended, and providers that were there as well. Also want to take a moment to acknowledge our partners who we couldn't have, had this event happen without. West Modesto Community Collaborative for allowing us to host the resource fair in their space, and also Stanislaus County Community Services Agency for collaborating with us on this event. I think I saw Carlos on the call, and also want to acknowledge Latasha as well. And then our MCPs that also supported in sharing out this information, and anyone that participated. Huge thank you to everyone, and excited for our next resource fair. So we can go to the next slide. Okay, so want to open up the floor to anyone that did attend and participate, just to get the opportunity for you all to share thoughts on if there are any successes or highlights that you experienced during the event that you would like to uplift. maybe share ideas on how we can improve our outreach efforts or leverage these efforts to improve provider referral coordination, and overall just looking for opportunities for improvement and what you all liked about the event. So I will pause and let anyone that attended have the opportunity to unmute and just share some thoughts. John, I know you were there during the event. If it's okay, I would love to call on you to get the conversation started if you have any reflections you would like to share with us.
Yeah, I first and foremost, I thought it was a great event. I believe that, we were had a great deal of providers out there for ECM and CS services. The only thing that I thought what we could have had more of is more recipients of those services attend. So that's something we could think about for the next one, is how do we get more attendees that would be available for ECM and CS providers to sign up. That's what I was hoping for, to be able to sign people up right then and there, to talk to them, to see if they qualify for the services, if they meet the criterias, to do cross references, referrals. So if they didn't qualify for my services, I can reach across the table and refer them to another organization right then and there for whatever services. So that's the only thing that I was hoping for. But other than that, I think it was a great amount of people that were there, supportive of each other. We got to talk to other providers and how their referral workflows are in place, and how to refer to them, and how to get referrals back. So I think that was overall, it was another opportunity to be able to connect with other agencies within Stanislaus County.
Thanks, John. Anyone else want to share any thoughts or reflections? I'll also put the link to our survey that we sent out to everyone that participated in the event. If you don't want to share in this forum, but that is still open. Really would appreciate any feedback that you all have as we work towards planning our next resource fair, which is not, we don't have a scheduled date yet, but we're hoping for October in San Joaquin County. So if anyone's interested in supporting planning efforts, please reach out as well. Okay, not hearing any other thoughts, so we'll go ahead and move on to the next slide. So wanted to follow up on one of the activities we did in our June in-person session, which was our provider referral mapping activity, to share some updates as well as build on some of the momentum we had going in identifying organizations that were missing or that we wanted to connect with. One of the conversations was around specific provider types that participants were looking to engage with more. So we kind of took the opportunity to go through our list to identify these some of these providers that offer these services like housing deposits, home modification, recuperative care, sobering centers, just as a follow-up for those that were interested. And I'm sure that we are missing organizations and we can expand upon this list, but this is a starting point. And if you would like to connect with any of these organizations, please feel free to reach out, and I'm happy to also share their contact info. But wanted to circle back on that piece, and then also have the opportunity to collaborate with you all in doing some outreach. So we can go to the next slide. Okay, so in our mapping activity, we identified three, I guess, buckets of organizations and providers. We identified who we provide referrals to, who we get referrals, as well as organizations that we're looking to connect with or that we're missing from the list. So we kind of went ahead and pulled out some of those organizations, which you can see on the right side, as well as different departments from agencies like Human Services, Public Health, that we wanted to engage with, but we may not have the right point of contacts yet. So wanted to take this as an opportunity to reach out to you all for support and get your input on how we can best outreach to these organizations that we have listed, as well as also create the opportunity if you would like to become an ambassador to help support our outreach efforts. So we can expand the providers that are in the room. And we've also created a outreach template that we've linked in this slide deck that provides an overview of CPI, the benefits of joining, and how they can get involved. So want to take this as an opportunity if anyone has some thoughts. I know we're a little bit of a quieter group today, so it may be the Monday just process, but welcome any thoughts on how we can best reach out to these orgs. And
This is Carrie Grover from Tracy Community Connection Center.
hi, Carrie.
Hi, how are you?
Good, how are you?
Good. Hey, I'm able to help with the United Way of San Joaquin.
Awesome.
Tracy Interfaith and St. Bernard's are two separate organizations. They're listed on the same line there, but I am able to help with Tracy Interfaith and potentially St. Bernard's, and also Tracy Unified School District.
Thank you.
Oh, and Prevail. I can help with Prevail as well.
Appreciate that.
So if you want to just, I don't know, send me an email separately about what you want me to do and how you want me to reach out to them, I will absolutely be able to help with that.
Perfect. Yes, I will reach out.
Thank you.
Any other volunteers or feedback on outreach? I don't hear any other comments, so I will move on to the next slide, but we'll definitely follow up if you have additional thoughts and would like to reach out or support our outreach efforts. So now I'm going to pass it to John to introduce our provider spotlight.
Yeah, so good afternoon, everybody. So today's provider spotlight is in regards to the justice involved area that we have been so interested in hearing about. I truly am interested in hearing what Alfonso has to say. So our next guest is Alfonso. He is from CMC. This is in regards to strategies to support the JI involvement.
Wonderful. Thank you, John. Hope you're doing well. It's good to see you. And thank you for allowing me for this brief space to talk to you a little bit about our JI, primarily our Transition Clinics Network program that we have been employing and providing support to this population for approximately 6 years now. As John mentioned, I am the Chief Behavioral Health Officer at CMC. I've been there for 16 years, and my role is to make sure that all services under the Behavioral Health Department, including recovery, ECM, community supports, case management, school-based services, and crisis services are kind of up to par. So can we go to the next slide? So just in brief, if you're not familiar with CMC, we have been around for since 1960. We're an integrated community federally qualified health center. This time, we have 28 sites with 10 mobile sites and also some school sites. And in this sites, we, for the most part, we provide integrated services, including primary care, behavioral health, recovery services, case management, medical specialties, WIC, and a gamut of services. last year, we provided services to about 121,000 folks, both in San Joaquin County, also in Solano, and briefly in Yolo. I mentioned my department is the behavioral health department. So for behavioral health, we provided a little bit less than 10% of our population for behavioral health. Those are about maybe 12,000 unduplicated patients that received at least one interaction with one of our behavioral health clinicians. And of course, definitely the other services, for example, our crisis mobile community response unit last year took about 7,000 calls just alone in Stockton. So we have a pretty robust continuum of care when it comes to behavioral health and case management. Next one. In terms of our Transitions Clinics Network program, this is a model that has been in existence for more than 10 years. Originally from the San Francisco area, where a small community-based agency developed this program, and essentially are responsible for expanding the network. I believe in California, there's about 27 different sites that are doing it throughout the state. And they also provide and have developed sites throughout the county, all the way from New York and even in Puerto Rico. So it's an evidence-based program that is focused especially in training healthcare teams that include community health workers, and this is the key, with a history of incarceration. The concept of the program is to use a CHW with lived experience, but also to do some very in-depth training of teams. In our case, in-depth training of care teams, which include a medical provider, nurses, behavioral health clinicians, in terms of the history and the impact of incarceration on individuals, especially when they're there, and also as they get out, really looking at the lack of resources when individuals are incarcerated, and the need and impact, which eventually, when those individuals get out, impact them in different areas. Certainly, again, the key of having the shared history between the CHWs and patients due to their lived experience is one of the key components of TCN. As I mentioned, we have been doing TCN and been certified through their program for about 6 years. And what is the CHW? What is their role? And I think we're very familiar with CHWs in terms of making sure that they engage with folks that are being released, which is the primary kind of responsibility in terms of their experience, and linking them, especially with CMC, with our integrated services, primary care, behavioral health, SED, certainly the resources or SDOHs, as most of those folks come out and are placed in specific facilities for a specific amount of time until they can be more placed in a stable setting. And of course, employment. Where do these referrals come? We have developed a process through TCN with CDCR, of course, internal referrals. Normally, the criteria is for someone that has been out for less than a year. However, we take all patients that present with a history of incarceration. The program focuses primarily on individuals being released from the state prison system. So at this time, we're not doing local jails, and do get enough referrals through this process through CDCR and TCN. Next one. So the process is a workflow that we've been using for the last 6 years. Of course, really triaging the needs of the individual, primarily focus on their medical needs. And as we all know, the comorbidity of issues that someone that's incarcerated, especially for extensive amount of times, can experience and endure. And as they're released, kind of the lack of linkage as they're released. As I mentioned to you, all referrals come from CDCR. Referrals are made to CMC through the Transitions Clinics Network, most often via email or phone call. We have contacts within CDCR with primarily RNs that are assigned to their system and are kind of the gatekeepers of referrals. We usually have about 4 to 5 referrals per week where there is a multi-systemic approach to meeting and the nurses discussing the individual's needs, when they're being released, where they're going to be placed, and our TCN CHW already having contact with the nurse and making sure that the details are addressed. And this is kind of the third as the case manager or CHW addresses this. Once the patient is released or the individual that's incarcerated is released, then the CHW contacts them. By that time, they already may have an appointment schedule, as on some opportunities, there is an opportunity to correspond with the individual that's incarcerated, but not all. At times, the individual may be there during the triage session with the nurse. However, this is not consistent, and as we all know, this is part of the waiver and making sure that we have contact with these individuals before they get out. Presently, we have 192 folks that have been released and are getting some kind of CHW and case management services through our TCN services. Next slide. You know, as we talk about some of the key details, as I mentioned to you, out of those 190 plus, even though the JI benefit is not activated per se yet in terms of workflows, we have been able to sign up about 70 of these individuals through ECM, through some of the other criteria, whether they are high utilizers, whether they become homeless, whether they are struggling with mental health and SUD. So a good percentage of these individuals are receiving services for SUD and behavioral health. Currently, we have 3 CHWs with lived experience that help us see a lot of those patients. And we have 3 care teams, including medical providers, that become champions of the program and provide this amazing trauma-informed perspective and contact with individuals as really the primary linkage is the CHW really walking in with the patient, introducing him, making sure the patient navigates our system. As we know, not only with this population, but with other population, immersing themselves in a system, especially a medical system, can pose some barriers in terms of even speaking with providers. So best practices, most definitely. In order to be a TCN CHW, you have to have had lived experience using the evidence-based model, as I've mentioned to you, pertaining to TCN. This is something that is theirs, and we have used their model as they have come in and trained our staff. When it comes to that, they run a collaborative where the entire country's system meets once a year and share best practices. And also for us to kind of evolve when it came to hiring TCN workers with lived experience. We had to look at our hiring process, to look at our HR process, in needing to make some changes, as unfortunately before they tended to be a little bit rigid when it came to looking at individuals or prospective employees in a more diverse and inclusive way. Lessons learned, shifting the culture. It wasn't easy, as I mentioned to you. This population unfortunately comes with a stigma, not only in terms of them accessing services, but our system and having stigma towards JI exposed folks. So really shifting the culture, making sure that we were training, making sure that we were providing resources to the staff, and choosing champions that were really interested in providing services to this population. And lastly, supporting the CHW. We found that some of the CHWs that we would hire were recently released, and they were transitioning also in terms of figuring out things in the community. So supporting them and not only with HR procedures, but with any other support, whether it was behavioral health, whether it was any support that provided them tools to be successful in their job. So, I think we have one more. Yeah, I think that words of wisdom has been really staying steady and shifting the culture of your agency. I think at this time, especially in a group like this, we should hope that all our systems were trauma-informed and were inclusive and equitable. But I can tell you that at least at CMC, we had to do a lot of work, even though we come with a long history, but really making sure that anywhere in the system that this patient went, that they were treated with respect, and really our care teams understood the impact of incarceration on their overall functioning. So nice and brief, folks. I think that's it for me.
I think Gretchen has a question, so.
Sorry, Alfonso, I'm so excited by your presentation. Thank you for sharing everything. I had a question about your process for matching clients with CHWs, if there were any criteria you used to make sure you had a good fit between the two.
Most definitely. Certainly, we look at areas where individuals were incarcerated, and of course, they're scheduled to come back to this area. Gretchen, we have kind of evolved so much that the CHWs that we currently employed are well known through the CDCR system, where we're getting referrals from actual folks that are still incarcerated. For example, getting letters and saying, so-and-so, I'm getting released this date and I'm coming back home. I heard about TCN and I need your services. So aside from looking at location, it's truly about the CHW getting well known and getting kind of this internal referral system through connection.
That's wonderful. Thank you.
Alfonso, quick question for you. So if I stumbled across somebody that had just been recently, discharged from a forensic unit, how would I refer them to TCN and be able to start that workflow process from our organization to yours?
Yeah, I think that because because we're part of ECM, we would follow the same contact person. You're familiar with Mireya. Mireya helps me oversee that program. The referral would be a regular ECM referral. And then when it gets to us, John, then we'll divert it to the TCN workers.
Perfect. Thank you so much, Alfonso.
Does that make sense? Yeah.
Yeah.
Okay. Great.
You can go to the next slide and just open it up for questions. I'll pass it to John to facilitate.
Yeah, so just to follow up just to what I was asking Alfonso, what questions does anybody have about the JI population of focus? I believe Alfonso did he did a wonderful presentation, so a lot of those questions may have been asked or answered during that, but if you have any others, please, this is a great opportunity to ask. And then how can we increase utilization of the services? I think that kind of alluded to my question, how do we refer people to the TCN network to get people connected to this great resource that Alfonso presented.
Well, definitely. I think that, as I mentioned to you, it's an ECM referral. We're excited to find out more about this, how we're going to develop a workflow eventually with CDCR, as we are busy as it is. And we're interested in seeing how, I guess I would say, new workflows and collaborations with the health plan would impact TCN. So we're excited to kind of see where that's going. The reality is that we're open for business. However, due to, I wouldn't say a specialty, but the need for extensive care coordination, workforce is an issue in hiring folks with lived experience. So as we get more referrals, we need to hire more CHWs. And at times we kind of want to put a bit of a waiting list, just because we also want to provide the most efficient and quality services to our patients. Normally, our CHWs have a caseload of 30 to 40, and they're pretty busy with those folks as they're coming out, and they're needing a gamut of resources. Eventually, with the waiver, some of you guys are experts at that here. I'd love to be able to have contact with folks 3 months before they get out and have their Medical already set up. So we're looking forward to that, hopefully.
I had a follow-up question, Alfonso. Is there any populations in that forensic population that you guys cannot work with, like the PC290s population or the arsonist population? Are those populations that you do work with also?
Absolutely. Anyone that is being released from a CDCR facility to this area, John, as you well know, they certainly come with specific expectations from CDCR. We have guidelines internally to manage those patients, and the CHW is
I think Alfonso's internet might have crashed.
It was getting good. I wanted to hear more. But yeah, so yeah, that was because a lot of the population that we work with sometimes have sometimes some forensic backgrounds that it makes it challenging to find them housing or get them into resources based on the offense they may very well have. So it's good that he's able to work with those populations that are challenging. So I guess that's it for this. Anybody have any other questions? Okay, so we can go to the next slide.
I think Alfonso just rejoined if
Okay.
he has any closing words.
Sorry about that, folks. I got a technological glitch.
No worries.
I hope you heard my response, John.
Yeah, I got it. Thank you so much. I appreciate that.
Yeah.
Okay, so
Go ahead, John.
okay, so it looks like on August 30th, we have a JI population of focus walkthrough question and answers. So join us during these office hours to learn more about the justice involved population of focus. So we're going to be covering what JI population of focus is. We're going to do an MCP overview of the justice involved implementation efforts. We're going to engage in a Q&A with the managed care plans representatives and peers. So once again, please join us on Friday, August 30th from 10 to 10:45, and you can click on the registration link there.
I will pass it to Gretchen.
Great, thank you guys. Well, a lot of these conversations have a key component, which we want to dig into a little bit today, and that is how do we improve our data exchange efforts, our care coordination efforts, our referral efforts. So we want to dig a little bit deeper into the different types of data exchange platforms that we can use today. I know Navneet mentioned earlier, the state is getting ready to release or has released some draft guidance for us to review and provide feedback on for closed loop referral systems that will launch in January. But we also want to focus on what we have today and how we can utilize what is currently available to really improve the services that we provide to our clients. So next slide, please. And you know us, we like to make sure that we're meeting people's needs and creating value with all the opportunities that we talk about. So we want to do a quick pre and post survey, and I know everyone gets a little bit surveyed out. We'd love to have you participate here. Let us know that before we dig into some pieces around data exchange, how familiar are you with using provider registries or HMIS? Not at all, slightly, moderately, very well, or extremely well. We have a few folks who are on that upper end, which is exciting. So join the conversation. Let me know when those survey results slow down.
I think we can move to the next slide.
Okay, great. All right, so most of you are slightly to moderately familiar with this, so that'll be good. We'll check in to see if we can improve some of your familiarity over the next few slides. So one of the things that we've started here at Health Begins, and I really want to emphasize the importance of contributing to, is our provider registry. And that is where we have created a form for folks to fill out about the types of ECM populations of focus that you serve, the types of community support services you offer, which health plans you're contracted with, and then if you choose to, who is the right contact for referral coordination. So we have that here. We have a lovely QR code. We encourage everyone to fill it out. But we also want to emphasize the different ways this can be important to the work you all are doing, as well as to the broader community. And we can talk about what that looked like in our resource fair that we recently had and the ones that are coming up. So we do have this form. We'd love to have you fill it out. We're going to talk a little bit more about the values. I think it's got multiple values, but we want to focus on a couple of important ones right now. That is care coordination, and then also trying to exchange provider information. So next slide, please. So some of the values that we think about with provider registries and how they can support all of us in the work we're doing is looking at how does it facilitate data exchange? And so could you, if you could look up who is providing, who is doing ECM for the JI population of focus, would that enable you to help exchange more information, share ideas, best practices with those other providers? Is there a way to improve care coordination with the provider registry? Could you call up someone to try to coordinate care for a client you're serving, or even to share updates? Maybe you encountered a client at a shelter that you knew someone else was doing ECM for. It'd be helpful to provide that information to other providers. A provider registry can also streamline the processes you're using. So instead of trying to look at each managed care plan's websites to see which ECM providers are serving particular population of focus, you could go onto the registry and really sort who does that. And so you can start to get more information more quickly through a provider registry. Next slide, please. And so one of the things that we've created is a downloadable form that's live, so it updates every time, and if people update their information, it will reflect that each time you download it. But it does allow you to really start to gather information and then to sort it and to organize it in a way that best works for you. And so as we get more folks using the provider registry, you can download this link and then you can sort by which community support service you're interested in referring someone to who's doing that in the certain zip code. So it really allows you to look at who's doing what and where very specifically and all in one place. Again, so you're not having to go to the different MCP's provider directories they have online. This will actually give you very current information as well as a point of contact for referrals. But yeah, and thank you for putting the sample prototype into the chat. You can check it out. And of course, if you have suggestions of how we can improve it, we would love to hear it, but we really want to get this going and have folks start to use this in real time. Next slide, please. In addition to referral coordination, we also found this to be really helpful, the provider registry, with our resource fair we had earlier. We could create some paper documents to hand out to folks about who's doing what. So community members could also access what services are available and which organizations are offering them. So again, another way to use a provider registry to really further the services being offered and provided to folks in our community. Next slide, please. So I'm going to just drill this home. We'd love to have you fill this out in real time, keep it updated so that we can all benefit from knowing which organization you're with, what services you provide, ECM, community supports, which populations of focus, which community support services. It'll be really helpful. And I really encourage folks to also put down a provider contact so that we can make referrals or call up with questions. It's really nice to start to build those relationships with other providers in the community. So I'm going to pause here for a moment, let folks do the QR code, but also if you have any questions or thoughts, would love to hear from folks how we could best use a provider registry for ECM and community supports. So I saw on the Kaiser slides, we had some folks telling Kaiser they wanted to have a more updated provider. They called it directory or a list of contracted providers. This will do that for all of us here in our counties. I heard, John and Alfonso talking about how do we make referrals? How do we contact you? Hopefully Alfonso has put his information into our provider registry so we can all check it out and email Alfonso. Apologize, Alfonso, for questions about best practices and how we can learn from the great work that you're doing. So really encourage all of you to do this, whether it's here today or after the meeting. It'd be really helpful to start to build up more of this provider registry. Any questions? All right, I'm hoping people are typing away. Let's move on to the next slide, please. So one of the other available systems we have to use for data exchange is HMIS, which is the Homeless Management Information System. And we have the Stanislaus Community System of Care here to talk about how they're using HMIS, how it can be used for ECM and community supports. So without further ado, because I know we don't have a ton of time, I want to turn it over to Linnell to talk about how they are, to Melissa, excuse me, to how they are using HMIS and the services that are available.
Hello, everybody. Let me go ahead and get, is the slideshow loaded on here or should I go ahead and show it, Navneet?
Yeah, we have it. We can go to the next.
Perfect. Okay, perfect. All right. Well, thank you everybody for joining us. My name is Melissa Lehman. I am actually an HMIS data analyst. There's actually 3 on the team. And then as you saw, Linnell Fuller, she is the HMIS administrator. So thank you so much for having me here today to give you this presentation. A brief overview of what the Homeless Management Information System is. Next slide. Okay, so what is HMIS? So HMIS is the Homeless Management Information System, and it is locally administered electronic data collection system that stores longitudinal person level information about persons and families who access the homeless service system. It is a web-based computerized data collection tool, and it does capture client level data over time. HUD creates and monitors the HMIS guidelines that need to be included in the platform for the system to be considered an HMIS. Next slide. So just a little bit of background, the history of HMIS. So HUD's HMIS initiative is in response to the 2001 congressional direction on the need for data analysis on the extent of homelessness and the effectiveness of the McKinney-Vento Act programs, which include developing unduplicated counts of clients served at the local level, analyzing patterns of use of people entering and exiting the homeless assistance system, and evaluating the effectiveness of these systems. So policymakers and planners at the federal, state, and local levels use this aggregate data to better obtain information about the extent and nature of homelessness over time, which can also make for better planning and seeing where there's gaps in funding. Next slide. Now, some of the benefits to using HMIS. So HMIS is going to collect client level data at the local level. It's also going to generate unduplicated counts of clients that are served throughout the community. It gathers information of clients served over time about those moving in and out of the homeless response system. Keep in mind, a lot of times the numbers from the point in time count are talked about. Now, the point in time count is only going to provide numbers of persons experiencing homelessness on one given night. Point in time counts do not usually provide information on whether a person was homeless for one day or a longer period, and have also been shown to underrepresent those persons who move in and out of homelessness throughout a period. So when you're using the HMIS system, you're actually able to track the client's story over time, seeing, when they began being homeless to maybe when they stopped being homeless, and maybe when they actually had to enter back into the homeless response system again because something happened with that housing. Also, HMIS has the ability to track member housing outcomes. So when households are housed, that is something that can be tracked in the HMIS as well. It also helps improve care coordination and integration of those services, making sure that there's not duplication of services. Also, the coordinated entry system is built into HMIS. And just so you know, the coordinated entry system is used to prioritize individuals and families experiencing homelessness for housing resources and services in the community. And those can include permanent supportive housing and rapid rehousing programs as well. Also, the ability to identify individuals experiencing homelessness who may be eligible for enhanced care management and community support services, and proactively conduct outreach and engagement and for enrollment, so member matching. So in our actual HMIS, we actually have, I believe it was implemented last year, where the client can actually choose which managed health care plan they actually have. So that's another way of tracking. And we also keep in mind, we participate in the state HDIS, which is the Homeless Data Integration System. It's a big data warehouse. And so that also includes the member matching for the health plans as well. Next slide. So just some different types of reporting. I'm not going to go too deep into the different types of reporting. We could probably be here for quite some time, but just want to give you, an overview of the different types of reporting. So like I stated, HMIS is a database that collects, stores, and analyzes data that's related to homelessness. So such as client demographics, service utilization, and outcomes. So some of the system level reporting is going to be like your system performance measures, also your longitudinal system analysis, which is the LSA. And this is actually the report that goes to Congress, including Stella, which is the LSA is also part of the annual homeless assessment report, the AHAR. So that combined with the PIT count makes up that whole report. Then we have your project level report. So that's going to be, your APRs, which is basically your annual performance report, your CAPER, your consolidated annual performance and evaluation report. Then we have our SSVF, which is going to be our supportive services for veterans families. And then we also have our RI, which is our runaway and homeless youth. We also do a lot of data quality framework reports. So obviously, we want not only just data, but we want good, reliable data in our HMIS. And then there's custom reports depending on what your agency is looking for. Keep in mind that we do have the ability to track you know, pretty much different things that you're looking for, even if it's something maybe you wanted to know how many people wore red shoes that day. You know, data in, data out, there is a way that we can track possibly what you're looking for as well. Next slide. Now, this is a very high level diagram of Stella. I'm not going to go too much into this. I just want to kind of give you a data visualization. This is actually a dynamic report that's generated from our HMIS data, and it kind of shows how people move through the homeless response system. So you'll see over to the left, there is 2,738 households that were served in the homeless system. And then from there, you can kind of see where each person's path went. So 92% went from being homeless to obviously still homeless, but then maybe going to an emergency shelter. Some then you can see that went straight to permanent housing or to rapid rehousing. So just kind of gives you a visualization of all the data that's in our system and kind of how those clients move in and out of that homeless response system. And then this is available through the HUD data exchange as well. Next slide. So again, like I mentioned, obviously data is important, but also so is the quality of that data. So we cannot stress enough the importance of data quality, which refers to the reliability and comprehensiveness of our community's data. Keep in mind there's 4 components to data quality, excuse me. We have completeness, and that's going to be the degree to which all required data is known and documented. So coverage and utilization are both forms of completeness. Also timeliness, so the degree to which the data is collected and then available when it's needed. Currently, right now with our county, we do have a 72-hour policy where we're asking for all intakes to be in within 72 hours of that contact with the client, as well as exits. And then consistency, or I'm sorry, accuracy, the degree to which the data reflects the real world client or service. And then finally, consistency, which is basically the degree to which the data is equivalent in the way that it was collected and stored. So just being consistent in the way that that's being collected and stored. Poor data quality can lead to loss of funding. And on the other hand, good data quality can tell the client's story. So if a client's moving through the response system, the homeless response system, that's kind of telling their story. And you can see from when they entered as being homeless, maybe from there they were, you know, accepted services into an emergency shelter, and they're working with their case manager at that shelter. And then maybe they moved into a transitional housing opportunity. And then from there, they moved into permanent supportive housing. It's also going to track that client's successes, you know, if they were able to obtain income or any type of non-cash benefits. Maybe the client came with no food stamp benefits, and you were able to get them connected through those resources. So good data quality can truly tell that client's story of how they pretty much started in the homeless response system, and then how basically their time ended in the homeless response system. And aggregate HMIS data can be used to obtain better understanding about the extent and nature of homelessness over time. And this, again, can help partners determine gaps maybe in services and where funding may be needed. Next slide. So part of our process is a very robust HMIS training. So we do have two phases to that. So all HMIS users are required to complete HMIS training. We do have a learning management system that's called Ecovia University. We refer to that as EU. So once somebody is signed up to be a user, that's going to be their first step where they get entered into the Ecovia University. And depending on what their focus is going to be at the agency that they're working for, we also have individual modules that can help them if they're focusing maybe on rapid rehousing, or maybe it's just the services only, community supports and things like that. From there, once they've completed that first phase of the Ecovia University, we then invite them in for a phase 2 training. That's actually where we are hands-on in person, and they're actually practicing what they learned. We do have a test environment. So we can actually have them enter fake client names with fake demographics into our test environment. That way they can practice to see how it actually is to enter in the data of the client, where they're basically what we have them do is do an intake, an update, and then an exit for their client, just so they get the feeling of actually doing it live. And then we also offer annual training. So we usually do our VI-SPDAT and seat coordinated entry trainings annually. We also have modules in Ecovia University for that, but sometimes there's agencies where people are only filling out the forms and then somebody else is actually entering in the data. So we try to help with the community as well. We do a lot of trainings that are just for the forms because if somebody's filling out the forms and they're not taking all this robust training, they're not going to understand the importance of why we're asking the data elements and those questions that we're asking. Next slide. So basically the onboarding process is we do have an agency access application, which is on our web page on our CSA website. From there, the agency will actually complete an agency designee form, and what that is basically certain job functions. I believe one is like the HMIS contact person, security officer. Basically, you'll give us the names in your organization that's going to be fulfilling those roles. And from there is how we get the MOA signature process started. Obviously, not always is the main signatory going to be the person, that we need to contact about HMIS program. So that's why we have the agency designee form that is going to be more of the people that are working directly involved with HMIS. After we get that MOA with all signatures, then we'll move on to getting any of the users that the organization is requesting to be trained. So there's a new user request form as well as a user policy responsibility statement that's required to be completed. And then from there, we'll get them going with the Ecovia University and all the trainings, and then fulfill the rest of the training that way. Next slide. Any questions?
That was a lot of information, Melissa.
I know. You can send us an email.
I was going to say,
any follow-up questions. If you have any real specifics, go ahead and send us an email. I know everybody's kind of doing a lot of different things with the different organizations. So if there's anything that you can't think of right now, but maybe you can think of later, just go ahead and give us an email right there at the HMIS@stancounty.com, and we'd be glad to get you going, get you set up, or answer any questions that you have. One thing that I just like to point out is, and I've talked about this on a few other calls, is the incredible work that's being done out there, and you really want that to show in the data, especially since a lot of the our data that we house in our HMIS system does go to that state database. So you really want that HDIS system to show, and the state to be showing all the incredible amount of work that you are doing and showing that client story, because I'm sure that there's all kinds of things that you're offering and doing with the clients, and it's not being told in their story. So just keep that in mind.
That's a really important point, Melissa. Thank you for ending with that. I think that makes a lot of sense. Well, thank you so much for your presentation. I'm going to have to go back and reread it and probably send you some follow-up questions.
Great.
I appreciate your time and all of the great information today.
Thank you.
All right, next slide, we're going to do our post-survey follow-up to see if these two quick presentations have helped you become more familiar with some available data systems that you can actually use right now. So we'll let you guys fill that out. I know we're running short on time, so we appreciate everybody and filling out this survey. I do want to make sure, because I know we have some really important items we wanted to cover in the last few minutes of the presentations. I'm going to turn it back over to, I think, Navneet to talk about what's coming up in the near future.
Thanks, Gretchen. Oh, I see Carlos raised his hand, so I'll let you ask your question. Oh, I think it disappeared.
Uh-oh, Carlos, do you need to?
Sorry, I did raise my hand. I just put it back down after you saw it.
You were fast.
I hate when I forget to put it back down, but I just wanted to real quick, first thank you to Melissa and our HMIS team for that presentation. I wanted to kind of reiterate how important the data is, right? And right now the managed care plans have gracefully offered to, there's some funding there to be able to provide for the fees, for licensing fees. And so if you are interested or you want to know more, please reach out, because we would love to set you up. I think that the more data that we're going to be able to gather on our community, the more we're going to be able to recognize and see the gaps and barriers that folks are facing. And then in turn, that will help us to know what kind of programs and kind of services we really do need around housing and homeless in our specific area and region. So again, if you are interested, please reach out to the HMIS website or myself, even. I'll put my email in the chat, and feel free. So I appreciate that.
Thank you, Carlos. I was just going to ask you for your email, so appreciate you putting that in the chat. Yeah. And yeah, thank you so much for raising that. All right, Navneet, turn it over to you now.
Okay, appreciate that. So really quickly, just going through some next steps. So we'll go on to the next slide. Quick reminder that we have office hours this Friday at 10 a.m. We'll be focusing on the JI population of focus, but our office hours are also opportunities to cover different topic areas. And for those folks that are interested and maybe want to have more of that one-on-one conversation or support, please feel free to email me at any time and we can set up a one-on-one. So we'll include the link to office hours in the chat as well, but we can move on to the next slide. Okay. So really exciting, want to share that we are having our next session in person on September 26th at the Health Plan of San Joaquin's French Camp office, not campus. And this will be an opportunity for us to gather in person to really build upon the conversations that we're having, to share best practices, continue our provider referral conversations, and celebrate our successes. So highly encourage. I will put the registration link in the chat. I know for our June in person, the attendance filled up pretty quickly. So we did accommodate for that this go around, and our venue's a little bit bigger, but regardless, encourage you all to share, because I know we have a lot of interest in our in-person. So encourage you all on the call that are interested to participate. Also encourage you all to share this with staff that are supporting your CalAIM program, referral coordinators, staff that manage billing. All are welcome to attend, and we look forward to seeing everyone in September. So we'll also share out this link via email, but sharing this here in the chat for those that are here today. So we'll go to the next slide. And then want to do a quick poll before we end, just to gather your interest on what topics you would like for us to cover during our September in-person session for any of that. And then if you don't have the chance to share now, you can always email me. There may be other topics that you would like to discuss, so please feel free to put that in the chat. I know our MCP Q&A panel was pretty popular during our last in-person, and we'll also have the opportunity to network and share other important updates. So thank you for everyone that shared some feedback there. We can end the poll, and then we'll go to the next slide. And then this last slide is just for us to get feedback from you on what you found most valuable from this session. I know we had a lot of presentations today, but appreciate everyone staying engaged and asking questions. Hope to continue to build on some of these conversations in our office hours on Friday. So we'll give everyone a quick chance to fill that out. And I see responses coming in, so we can move to the next slide and then close down that poll too. And then just next steps, we will, actually, let me do this right now, pull up the office hours registration. And one thing to note, you may have noticed that we've updated our Zoom links to be one reoccurring Zoom. So if you register through this link, it will give you the links to all office hours for the rest of the year. So just wanted to make that note and to register for our in-person session. We look forward to seeing you, and then continue to implement improvement practices. And we have the link to our current improvement practices that peers are working on. So I know that was really quick, but I will be sending an email to summarize some of these next steps. Really appreciate you all today, and I hope you have a great rest of your Monday. Thank you, everyone.